Well, good afternoon to our alumni, our families, our guests, and welcome to Homecoming and Family Week. My name is Lauren Griffith, and I have the pleasure of working in the Office of Engagement with our graduates and families. I will turn it over shortly to the leadership team in the Brooks Rehabilitation College of Healthcare Sciences, but first I just wanted to go over a few housekeeping items before we dive into the event today. You might have noticed once you got into the event that you were muted upon arrival, but please go ahead and turn on your camera so that our guests can see who all is in the meeting. You can go ahead and change your settings also from grid view to speaker view for the program so you can easily see the speakers. We're going to be taking you on a tour of the Student Health Center, so you'll want to be sure to have that setting all set up for you. We will also go ahead and ask that you rename yourself so we can easily keep track of who's in attendance. If you're an alum or a parent, you can go ahead and add your class year or your student's class year to your name as well. And if you'd like to submit a question for the Q&A at the end of the event, please feel free to do that in the chat. You can send those directly to the moderator as well. Lastly, as you may have noticed in the top, the session is being recorded for us to put out onto our YouTube channel after the event. So it looks like we have had a few more people join the call, so we'll go ahead and get started. Welcome again to the Parade of Colleges. This is just an opportunity for us to catch up with college leadership and learn about what's new in the college and with its faculty. As I mentioned earlier, there will be a Q&A at the end of the session, so please go ahead and drop in your questions to the moderator as they come to mind, and we'll make sure that we save them to be addressed at the end of the conversation with our leadership from the college. And at this time, I'd like to introduce our speakers. So Dean Mark Tillman joined the college in February of 2020. He specializes in biomechanics and exercise science. Throughout his 20-year career in higher ed, Dean Tillman has extensive research and training experience and success in developing new programs and creating important partnerships with large healthcare organizations. Dr. LaTanya Summers joined the faculty in 2018 as an assistant professor of clinical mental health counseling. Dr. Summers has over 20 years of experience in the field of clinical counseling and supervision. Professor Amber Santos is also here as a speaker. She's a clinical assistant professor of nursing and a 3-time JU grad. She's earned her BSN, MSN, and MBA degrees, and she is currently set to complete a 4th degree, her DNP, soon. Amber has been a student since 1995. Finally, we have Dr. Elaine Bourne, who is on the call with us today. She's a 2-time JU grad, and Dr. Bourne is a clinical assistant professor of nursing and director of our new Student Health Center on campus. Dr. Bourne has really filled a very critical role for JU throughout the spring and into the summer in helping develop our COVID response and creating our fall reopen plan. She is without a doubt one of the busiest people on campus, so we're so happy that she could be here with us today. Now our college leadership has prepared a really great session for you all today, so I will ask our speakers at this time to go ahead and unmute your microphones. And I will turn it over to Dr. Summers to kick us off. Thanks so much.
Thank you so much, Lauren. Welcome, everyone. Dean Tillman, you've been a part of the Brooks Rehabilitation College of Healthcare Sciences since this summer. Can you tell us more about your background and how your first few months have been going?
Thanks for the question, LaTanya. That's a good one. And I could probably spend all day talking about that, but I won't. I'll save everybody all the gory details. As far as my background goes, I would say I'm pretty unconventional when it comes to healthcare sciences. And the reason I say that is because I'm basically an engineer. And my first couple of degrees are in engineering. And I started leaning this way when I got a minor in biomedical engineering. And I went on to get a master's degree that focused on biomechanics. And then I switched over and earned my doctorate in an exercise science department, again, focusing on more biomechanics and actually sports medicine. So it's been kind of a roundabout way to get here, but what I ultimately ended up doing as a faculty member was teaching human anatomy. And I taught a lot of students human anatomy, and I taught undergraduate biomechanics and graduate biomechanics, and had some really great experiences in study abroad. And once I had worked my way through a lot of those things, I really wanted to do more, and I wanted to get more of a leadership role. And I ended up finding an opening at Troy University in Alabama, and I went there to become a department chair. and ultimately became a dean at Troy of a College of Health and Human Services. From there, moved on to Kennesaw State University in Georgia, and was dean of another Health and Human Services college. And ultimately was lucky enough to be selected to come here. And now I feel like I'm home. This is really where I really want to be. And the first few months have proven that to me. It's been tough, but it's been great at the same time. And one of the reasons I really wanted to come here was because Jacksonville University has tremendous leadership. With between President Cost and Provost Sapienza, we can't be in better hands. And these first few months for me have definitely been evidence of that. We're seeing it every day. I just went online and checked the number of active COVID cases we have on campus, and the number is 3. It's unbelievable. Other universities are not seeing this kind of success. So, like I said, it's been I'll say a challenging start, but things are going great. I'm happy to be here and looking forward to more.
Thank you. We're blessed to have you. Thank you so much. I'm going to turn it over to you for the second question.
All right, thank you. This one is for you, Latanya, and for Amber. So if we'll start off with Latanya. We get a question a lot from our alums and their families, and they'd like to know how things have changed in our college since the spring, and how our college is adjusting to this new normal of education.
Yes. How have they not changed? But just in some of the ways in which the university has changed, or at least our college has changed. Man, I've appreciated what our college and JU has done regarding what I call a pandemic pivot. I mean, like, we've just pivoted all the way around, like having to teach from masks has been a huge adjustment, which I was not expecting, but teaching from masks. But the college has provided things like microphones to help us project our voices from behind the masks, and just using state-of-the-art technology, which has just been amazing. And the college really, and the university just anticipated changes. It anticipated our needs. I'm like, how did you even know that I would need A, B, and C? So when I went into the classroom to teach, those things were already there. From the clinical mental health counseling department, we are using a hybrid method to limit hybrid instruction to limit students' need to come to campus. So we're teaching face-to-face just to make sure that they do get that experience, that they are, still feel like they're matriculating as a cohort, which is great. And then we're teaching online synchronous, still to give that face-to-face feel virtually, as well as teaching online asynchronous. So it's been amazing to move between those 3 different kinds of modes of instruction. That's one of the ways in which we're contributing to those low COVID numbers, Dean Tillman, as well as just being creative in the classroom to make sure that our students' needs are getting met in the field and in the classroom as well. So those are some of the ways in which we've pivoted in the clinical mental health counseling department. Thank you.
That's great. And Latanya, I believe as a department, you've been collecting some data from your students. How are they responding to these changes?
Yes, we've since sent out surveys just to see how they are acclimating to the 3 modes of instructions, not being face-to-face. Of course, all of them want to be face-to-face. That's the biggest point feedback that we've gotten, but most of them, for the most part, are really grateful that we're doing something to protect them as well as ourselves. And they don't feel like their instruction has diminished. They still feel like they're getting cutting edge instruction even online. And so we're so very proud of that, and we work really hard to make sure that they feel that way.
That's great. I'm glad to hear that they're pleased with your efforts too. Thank you. Amber, would you like to chime in on this one?
Yes, absolutely. So I feel the same way as Latanya, that it seems like we went from, normal to very different and almost overnight. I remember going to Spain over spring break and having to come home early, and then all of a sudden change everything to clinical. You know, in clinical, we went from being in the hospitals to no longer going in the classroom to no longer could do that. So I have to say that the undergrad faculty really showed a lot of just grit during that time, and very innovative in the way that we taught. It started actually very quick with our alums, believe it or not, reaching out to many of us because we still keep in contact with them, reaching out and just telling us whether they graduated 3 months prior or 3 years, graduating and saying that they're kind of scared. And so once we heard that, of course, we jumped in and we provided support to them. We had efforts where we even were making masks and delivering those to the community. So even President Kost's wife was wonderful at sewing a large number of masks for our alums. So we not only had to pivot for our current students, we also had to pivot for our alums and remind them that we are here for them. We created videos, we provided the masks to just show them that you're part of the JU family and you will always be that way and we'll always be here for you. So we had to quickly convert clinicals to a virtual environment. So that was something we learned rather rapidly how to do that. But like I said, we had already had a few things in place. So we were already using technology. And so it just, even though it was a considerable amount of work and effort that we put into doing it, we were still able to do that. So clinicals went virtual, theory courses went virtual. We have since now limited, now in the fall that we're able to go back, we limit the number of students that are in the classroom. So half might be live in the classroom and the other half is virtual. So we've gone from hybrid courses. We're doing some, a little bit more team teaching too. So as you guys know, if you've ever been on a computer for 3 hours, right? Because if it's a course where you have to be there for 3 hours, it's good to have faculty that we love to work with each other, and really they feed off of our energy. So it's great to have teamwork as well. So we, quite a few of us have done that. So the students are getting a 2-for-1 education. So like I co-taught PEDS with Dr. Wolf, I've co-taught leadership with Professor McCrae. And the students really enjoy that as well. So we've converted those things. And we've learned a lot of lessons along the way. And I'm proud to say that we were able to adapt. And I feel we have come through this even stronger than before. One of my favorite quotes is, all great changes are preceded by chaos. And I think that we learned a lot from this. And I feel strongly that we still have provided a fantastic education to our undergrad nursing students. So very, very proud of everyone involved.
Yeah, that's amazing. I appreciate those words. And I know that President Kost does too. A couple of the ones that really stood out to me: pivot, adapt, and teamwork. And I think those three really exemplify what we have going on in the Brooks College right now.
Yes. Okay, so I have the next question for you, Mark. For the alums or others on the call who haven't been on campus in some time, can you tell everyone about our new health sciences complex?
Yep, I'm glad to, and I'll start by saying when this pandemic is over, we welcome everybody to come visit in person, because we're proud of our new facility, and we're really lucky to have it. We moved into the new complex in January. Unfortunately, we were derailed slightly when it came to the pandemic, but we're still doing really well. We're lucky to be in this brand new 105,000 square foot building. And when I hear numbers like this, I have a hard time conceptualizing how big that really is. So I did a little calculation before today's discussion, and that actually equates to about 70 moderately sized 3-bedroom houses. So if you can think of us doing our work inside 70 houses, that's about where we are right now. And we currently have parts of a lot of our programs in this new building. For example, we have our graduate nursing faculty members are housed in here. We've got state-of-the-art classrooms, brand new laboratories, including a virtual reality anatomy laboratory that is primarily focused on occupational therapy, but our other departments are using it too. We have kinesiology in the building, communication sciences and disorders, clinical mental health counseling. So we're delivering a lot of our academic program out of this new building. And some of the other things that are quite interesting too, we also have our School of Orthodontics in this building. And in addition to that, we have a full service orthodontics clinic that's open to the community. We actually reopened that clinic in June, and we've been doing business, serving the community ever since. And I'll add serving safely. And one of the other, and perhaps the newest addition, is our new student health center. And that is something that has been drastically needed at Jacksonville University. And it's a tremendous service that we're able to provide our students now.
All right, thank you. And perfect timing, I have to add as well. All right, so I believe, Tanya, I think you have the next question.
Yes, I sure do. And it is about that student health center. For years, we've been planning to open one on campus, and we're thrilled that it opened its doors this fall, as you mentioned. And now, during the pandemic, it's filling a critical role in our campus community. So Dean Tillman, will you talk a bit about the new student health center and how our college is at the center of COVID response?
Well, I'll just say a couple of comments because I'm not the true expert in this area, but luckily we have the expert with us. Boy, the opening of the clinic couldn't be any more timely. Boy, the pandemic has really illustrated the need for providing this kind of service, and luckily we have the executive director of the Student Health Center on this call with us, Dr. Elaine Bourne. In addition to running this facility, she has been a real leader for us in terms of serving on the JU COVID-19 task force. And if I could turn that over to you, Dr. Bourne, I'm sure you can address this question about 1,000,000 times better than I can.
Sure, absolutely. I might have a little bit of background here, but I am actually in our foyer, and I want to give you the opportunity to take a look at our Student Health Center. You know, Professor Santos, you probably remember just as much as I do, when we were students here at Jacksonville University, undergraduate students, we didn't have a health center on campus, and our services were offered at the Care Spot. I think it may have been called something else back then in the 1990s. And are you still with me? My phone just did something a little funny.
Yes.
Sorry about that. So, but you remember back then, you know, we had to leave campus to receive any services. And I remember when I lived in the dorms, I had to leave out of the dorms to go off to Cesare Boulevard, which is, you know, a few miles down the road to receive services, any type of healthcare services. And that's what our students have been receiving for years. And one of the things that we really wanted to do with our health center was we really wanted to partner with our students. We don't want our students just to come in for an episodic type of issue. We want to be able to provide services and really partner with them and walk with them through their health issue. And what a perfect time, but with COVID. Never did we imagine 2 years ago when we started this process of developing our student health center that we would actually be in a pandemic. So it's worked out as a perfect time, and really this pandemic allows us to really flesh out our mission and our vision of the student health center. So I'm recognizing I'm having a little bit of background here, and I don't want that to get in the way of you being able to hear me. So I'm gonna show you a quick shot of our student health center from the outside, and then I'm gonna step inside. So let me see if I can turn my camera around here. All right. All right, there you go. So you can see the outside of our students' health center. We're just inside of our health sciences complex. And you can see we offer services Monday through Friday for our students. And it's 8:30 to 5 that students can be evaluated in our Student Health Center. We don't have any students in here right now, so we're not going to violate any HIPAA guidelines. And so, but students can receive services here in our Student Health Center, 8:30 to 5. And it's all students who are undergraduate students and graduate students are eligible for receiving students here at our health center if they pay the student health and wellness fee. And that student health and wellness fee is a new fee that we have here for our campus, but it looks at not just the student health center, but it covers for services provided at the counseling center, as well as services such as in the gym and being able to buy new gym equipment. So this is our waiting area right here. We got a little bit of work to add to this. Like I said, we are just in the beginning of this. In the week before class, we were still putting paint on the wall. But here is our front office coordinator. You can see her through the glass pane here. That is Veronica. And Veronica is our front office coordinator, and she is the person that you will be in touch with when you call the Student Health Center. She is the front lines of our Student Health Center. She is going to help you make an appointment. We actually offer through our electronic medical record system the ability for students to schedule their own appointments. But as we've all had to pivot with COVID, right now we're not doing that. We are scheduling appointments for students. So we're asking students to call the Student Health Center and we'll schedule an appointment for you. So that's Veronica. Veronica, if you could let me in the door, please. All right, so I'm going to step on back here. So this is our front office here. I'm gonna try my best with my I'm not the best videographer here. So here's our hallway, and we actually have, let me see if I can get a shot here from our office manager, Kata. And Kata, you're about to graduate too from JU, aren't you?
Yes, in December.
In December, so she'll be another JU grad. I don't know if I did say I'm a JU grad back in the 90s, and Professor Santos is a JU grad, alumni. This is one of our exam rooms. We have 3 examination rooms, and you can see here, it's just like if you go to your primary care office, and you're going to see your primary care provider. One of the things that's so very important to us here in our Student Health Center, you see a whiteboard, is that we're going to do a lot of education here. As I mentioned earlier, really our mission and our vision is to really partner with our students and teach them about their health care. And one of the things that, I'm going to flip this around for just a second. One of the things, just happened to me recently with a student. I was talking with a student and we were actually having a telehealth visit and they're talking to me about their allergies. And he's saying, I'm allergic to this particular medication. And he couldn't tell me anything about the medication, didn't even know that it was an antibiotic, but he had a significant reaction and didn't understand the significance of that reaction and the outcome that could be so poor if he had that medication again. So we had the opportunity to really talk about that and the importance of knowing that medication, other medications he could possibly be allergic to. So that's what we're doing here at our Student Health Center. We are like a primary care office that we provide services, the common cold, viruses, flu, mono, bronchitis, COVID management, whatever it may be, women's health services. We do that. We also provide services for allergy injections, flu shots. Hey, don't forget get your flu shot. We have them here at the Student Health Center, $20, faculty, staff, students. We are giving flu shots, so come by and see us and we'll get one for you. But those are the types of services we offer here at our Student Health Center. So here's another one of our exam rooms here. So we have 3 of those rooms. And then the other thing that we offer here at our Student Health Centers, we have a lab here, and we can draw your labs for you here at the Student Health Center. We've actually had students that they're from out of state, New York, New Jersey, and they have providers that are managing their care outside, their home provider in New Jersey and New York, and they will actually send us a lab order. And we will draw that for them here and send it back to their provider, who will then conduct a telehealth visit for them. Maybe a dermatologist, maybe somebody's on Accutane or something, they need to have labs drawn. And so we'll do that for them, send them back to their primary care, their dermatologist, who will then have a telehealth visit and manage that for them. So we are here to partner with our students and help them with those types of services that they need. One other thing I wanted to show you, we're going to talk a little bit about COVID here in just a second, but I wanted to introduce you to one of our other providers. Let me see if she's back here. Hang on, I got to turn my camera around, Dr. Wolf. Dr. Lindsay Wolf. She is one of our nurse practitioners here. She's also clinical faculty in the nursing program, the Keglin School of Nursing. and she's one of our providers. Super excited to have her on board. One of the things that we actually love about our health center is that our student health center is really run by nurse practitioners. We have a collaborative physician that we are able to call on to answer questions if it's something that we need consultation about. But we have nurse practitioners that are here. All of them are on faculty here on campus, and this is their clinical practice site. And that's one of the things we absolutely love, is that our faculty are actually able to practice right here on our campus. And between all of us, there's 5 of us as providers. We have over 100 years of clinical experience that we here to our university and to our student health center. And that's super exciting, that the years of experience that we can offer here to our students. One of the other things that we do here is we actually test for COVID in our health center, which I am super excited about that. We don't do rapid testing. We actually do testing by PCR. And we have had the opportunity to partner with a laboratory company here in Jacksonville. It's actually a local company, Consolidated Laboratories. And they actually can do our test for us. We've had the results as quick as 4 hours. And probably the longest that we've had thus far is about 36 hours. And so we're able to really identify very quickly those students who are positive for COVID, and then get them the support and the services that they need while they're in isolation. And that's something that's so very important, is with COVID, that we move very quickly to keep our campus safe. And our team, we've had an amazing team that has really been working since March. Day 1, when this started hitting the United States, we started meeting, and we were meeting every single day to really come up with the plan that we needed to protect our university. And our leadership team has done an absolutely amazing job, and they continue to work with Jamie Burkett, working in the Dean of Students. She does an amazing job. She is our COVID response coordinator for the entire campus, and she is an excellent resource for our students and really providing the services that our students need when they're in quarantine as well as in isolation. And so we are really super excited what we can offer here on our campus for our students and our student health center. I'm so very thankful that we're here. It has the opportunity really to be at a center point because of this pandemic, and we're able to support our campus, support our students and our faculty during this time. So I'm glad you guys joined us, and let us know if you have any questions about our student health center.
Thanks, Elaine. Thank you for the tour, and more importantly, thank you for everything you do for us and for our students. We really appreciate it. Boy, yeah, COVID is definitely near the top of the list of all of our topics that comes through our news channels. And as we've seen so heavily covered in the news, COVID has shed light on so many healthcare disparities and inequalities. What are some of the ways we address this in the classroom, and how are we preparing students to work with diverse groups and to be culturally competent? LaTanya, could you take this one first, please?
Absolutely. That's a really great question. What was supposed to be like a 2-week shutdown for the pandemic, remember that? Was an immediate illumination of racial, ethnic, and healthcare disparities, especially with, African-American people being 3 times more likely to contract than white counterparts or white residents, and then twice as likely to die from it. And then here we are 7 months later, and Black people still have the highest death rate from COVID. I was teaching social and cultural foundations and counseling when COVID hit, or what I coin as multicultural counseling. I was teaching that course when COVID hit. And one of the very first things I did was immediately shift my assignments. Here I am teaching social justice and advocacy and multicultural competence in this particular course. And what I ask my students to do is to find 2 to 3 resources for marginalized people. That's the elderly, people with disabilities, parents who have children who have disabilities, African-American and Latino and other ethnic minority groups. Find 2 to 3 resources per group, and we're going to compile a list and get it out into the community. Now, I just thought, I don't know what I thought. I didn't think it would be as big as it was, but it ended up being this amazing resource that we released to our faculty and staff here at JU, and people were so appreciative to have these resources for elderly and other marginalized population. That list made it all the way to the Mayo Clinic, Florida bar, the Bar Association of Florida. And then we started getting requests from other people from St. Petersburg, Tampa, Orlando, asking, can you compile community resource lists for us as well? So that's one of the biggest things that I'm very proud of. My students were I don't know, they were so honored and so proud of themselves for doing something that turned out to be a great benefit to communities, not only Jacksonville, but throughout the state. So those are some of the ways in which we pandemic pivot to, I don't know, make our lectures, make what we teach three-dimensional. Not only are we teaching it to you, but you're actually doing social justice and advocacy for people who are marginalized, invisible, don't have voices or resources. And it's one of the things I teach my clients. We all have power and privilege. Use yours for people who don't have as much power, influence, or privilege. Thank you.
Thanks, Latanya. That's amazing. One of the things that I've always found so great about being in education is that it's not just us as educators providing information to our students, but we learn from our students just as much, and that they're a resource for us, and we need to respect their expertise and their knowledge when it comes to these things.
Absolutely.
Amber, would you like to provide some more information relative to how we're handling this in the School of Nursing?
Yeah, absolutely. I really think that a lot of this comes with just asking questions and really being active listeners to get more information. I always tell my students, the more I see, the less I know. And that's actually a good thing, because you want that to be the case, that you don't even know what you don't know. So we should be constantly learning. I am very proud, though, of the undergrad program. We really do just thread transcultural concepts throughout our entire curriculum. We talk about this in every course that we're in. So an example is, I just lectured on this the other day. An example is asthma. In addition to talking about the disease process, of course, you know, it would be wrong of me not to mention that African Americans have a 60% higher prevalence of asthma. They have a 250% higher hospitalization rate. They have a 260% higher ER visit rates, and they have a 500% death rate, higher death rate compared to white children. So this, to me, that, you know, it's impossible, right? If you're a true educator, to talk about a disease without talking about these things that we know as well, and then talking about, well, what can we do differently? So for me, it's talking about, well, let's talk about this. What might be causing this? It could be anything from even the words used to describe asthma. Perhaps they're different, right? So it starts with us as educators, threading this throughout our curriculum, holding ourselves accountable as mentors and best practice, and being active as well. So for instance, I know that Ann Husinger, she's one of our undergrad faculty. She serves on the Academic Diversity Council, and really the point of that is to just raise cultural awareness and confront systemic racism. So we have quite a few people from our college that serve on these committees and subcommittees. One thing that I do want to, you know, praise us for, even though we're constantly learning and wanting to do better, is an example, for instance, in nursing, is that the national average for males in nursing is just simply 9%. Right? So of the population of males, there's only 9% in nursing. I'm proud to say that our program, the undergrad program, it varies a little bit from year to year, but it's pretty consistent. And this last year, which includes last fall to now, we have a 16%. So that's significant to me. And another, for instance, the group we're about to graduate in December, it's 20%. So, you know, I'm happy. If we're twice what the national average is, I'm happy about that. And then another thing, if we look at the number of nationally, the number of African-American nurses, that is about 9% African-American nurses. And I'm happy to say that at JU over the last year, it was 20%. So to me, you know, we're doing something right when we understand the value of diversity and what that brings to a profession. I'm very proud of the numbers that we have, and we have a lot of growth. We have a lot of room for improvement, but I just wanted to talk to those numbers and say that, you know, as a college, we understand the importance of diversity.
Very good. Thank you very much for that. You know, I can echo that sentiment. We very much value diversity, just as we do at Jacksonville University as a whole. I think it's also important that we recognize that although we're making strides, there's a long way to go, and we're committed to keep working on it. Both of you talked a little bit about community, and there's another aspect of community that I'd like you both to address in the next question. We're actually really lucky to be in Jacksonville and to be in a city with tremendous healthcare partners. Can each of you talk a little bit about what practical experience looks like for our students this semester as a result of the complications from the pandemic? You want to start us off, Amber?
Sure. Obviously, things have changed drastically. So in the spring, we went from being in clinicals, going to spring break, coming back, no clinicals. So that's what it looked like. And we adjusted very quickly to that. Luckily, we have wonderful relationships, the faculty with our community partners. And I actually reached out to quite a few of them and said, what are some things that you do within your organization, you know, to teach virtually? And so that was a wonderful thing. But we are lucky, very lucky that we have such great partners. So we transitioned out of spring, moved into a summer where once again, you know, classrooms were virtual. I have to say, I have to acknowledge Orange Park Medical Center for being the only facility during the summer, yes, that allowed us to come into the clinical setting. So we placed 37 students at Orange Park over the summer for their synthesis rotation, which is a very important rotation because this is the last rotation before they go out and practice as nurses. So I'm very thankful that Orange Park did that for us. And then we've transitioned into fall, and it has been a transition. So it's been wonderful. We've had a lot of our community partners. So for instance, Psych, Gateway, Wakiva, these were still available to us and open. So our Psych rotations were handled well. Our community rotations, so the ARC, the Department of Health, Job Corps, PACE, the YMCA, these were all open to us as well. So our students could still have a rich clinical experience for community. I know that Wolfson's Children's Hospital opened up just a couple weeks ago, so our students were able to have a couple weeks with them. And then Orange Park, of course, remained open to us as well, so the HCA system. Baptist just recently opened up within the last couple weeks, and St. Vincent's was open for the fall as well. So our med-surg students and critical care students were able to go in. So, and UF as well, just recently is open. So it's been a change, but we're very blessed to live in a community with so many community partners who enjoy our students and actively recruit them. So I feel that we're very lucky to have that, and we've transitioned well through this.
Yeah, that's great. And could you speak a little bit? I see the end result of this, you know, the success of these partnerships and what we're doing in the classroom and the simulation labs. I see it on our licensure pass rates. How have we done since the pandemic hit us?
Actually, we're waiting for the summer results right now, but our spring cohort that graduated, their pass rates, I don't know exactly the rate, but we've been in the 90s, so I'm very happy about that. And the summer group that just started, all of the students that have reached out to me, they've all passed the NCLEX. And I think there's a lot to be said for that, because some of them weren't in the clinical environment for weeks. So I think that's they need to be acknowledged for the hard work that they put into that, and I believe faculty as well need to be acknowledged for they took you know, having clinicals in the hospital to doing it virtual, but still have these students educated, intelligent, critical thinkers, and pass this NCLEX. There's a lot to be said for that.
Very good, thank you. Latanya, can you provide some information relative to this topic too, please?
Yes, absolutely. As Amber said, the response to mental health has been just as great, probably because of the pandemic and the emotional response it evokes, right? The mental health field just flooded with opportunities and with clients. So if anything, this shift just signaled to our students that they had made a right decision. It was like job security. And so luckily, and gratefully, thankfully, all of our students have been placed. All of the counselor centers were open. The only change was, instead of providing counseling face-to-face, it was all done virtual. So counseling has gone virtual across the country. And what we did is we provided teletherapy, best practice in teletherapy, which is something we'd never done before. We've always trained our students to practice in agency and in office, never before, or, we just touch on, telehealth, but we were actually able to provide at least a 2 to 3 hour training on best practice in telehealth. So we're also, I just submitted a grant to build a virtual community counseling center. So if anything did shift, in the community, or that our numbers grew with students, hopefully JU would have a place for our students to be able to practice as well. So keep your fingers crossed. I'm so hoping that goes through, but that we could train our students on site to be able to provide services for the community that sits across the street from Jacksonville University. Thank you.
Thank you. We'll keep our fingers crossed.
Yes, thank you, thank you. And our pass rate on those exams, students just took that exam in August, and we had 100% pass rate first try. So super excited about that. Yes.
Excellent, thank you.
Wonderful. Dean Tillman, if that is all that you all had prepared, I can go ahead and move into the next portion. Thank you all again for your remarks. And obviously, as you can imagine, access to the Student Health Center is pretty restricted these days. They're not typically open for tours. So Elaine, I'm so glad that you were able to give our guests that inside access. I hadn't been able to see that yet, so it was really wonderful. I know that our families too have been asking a lot about that. So very cool that we'll have that for everybody here and then recorded afterwards as well. I received some questions throughout the session that I can go ahead and pitch to our panelists right now on the fly, but if you have any other questions, feel free to enter them in the chat to everybody or just to me, the moderator, and we can get those here as well. We got a question from a parent about our reputation. And I know that I hear from community members and friends in the healthcare system that there's really something special about JU grads. When I tell them that's where I work, they say they can kind of spot a JU grad from a mile away. What are our clinical partners saying that you all hear about our students in that setting, or about our graduates? And in your perspective, what makes them stand out?
I can speak to this first if I can.
Yeah, that's great.
Sure, absolutely. I've been a hospitalist nurse practitioner for 20 years now, and I can tell you in all honesty that when I'm rounding on patients and I come up to a nurse and there's this critical thinking that is just remarkable, and just the nurse stands out. There's something about them, and I will look at this nurse and say, where did you graduate from? And they'll say, JU, and I'll just chuckle because I can pick them out. There is something, and now that I've been on faculty here and worked and taught within our College of Nursing, the critical thinking that we really challenge our students to critically think. And, I had the opportunity for a few years at the undergraduate level to teach pathophysiology. And, it's not just coming in, giving a lecture and a PowerPoint. But one of the things that was so very important to me was to ask them the why question. Why is it like that? To begin that critical thinking and knowing that these are the students who are going to take care of our parents. take care of us, and then even take care of our children. And just recently I had a family emergency. My sweet boy had to be in the hospital, and he was in the hospital for quite some time. And I cannot tell you how many JU grads came in, and it was so funny. He's 14, and his first question when that nurse would walk in, "Are you a JU graduate?" That was his question. And it's because we know that we have the A team, and it was clearly evident. And I just was so thankful to have our JU grads really watching over my sweet boy while he was there in the hospital. And so, yes, I can speak to it as a provider and easily able to identify our JU grads with the critical thinking and the outstanding bedside skills that they have, but then as a parent as well, and recognizing how they stand out when they're taking care of a family member. Truly amazing. And our community partners see it as well. And they're at the hospital. It's so funny. He is at a local hospital here in town, and we had lots of JU grads. And I said, wow, we have lots of JU grads. Oh yes, our manager loves JU grads. And so it's in the hospital, it's in the community. They love our students, and they do an excellent job. And we have an amazing group of faculty in our nursing program. They have an outstanding program that we've had for many years, and they continue to provide great teaching to our students. It's really awesome, and we get the benefit of it. So I'm very thankful.
Thanks. I can piggyback off that. I like to say that we foster a culture of curiosity, because I think that critical thinking starts with a curious mind. And so we teach them how to have that curious mind and ask questions and ask more questions. And then, of course, we have a very rigorous program. I can speak to how hard that was, and so can Elaine. And between that and then the connection you make with the faculty, it is just a recipe for success. I teach leadership, which is the course right before they graduate, and I have a recruiter event, and I'm amazed at how the recruiters really, I'm not going to name names, but they're very clever in their way of trying to get the students at their facility first, to come work there first. So it's interesting for me to sit back and watch it happen as the recruiters are recruiting our students, but it's growing. It used to be just our local hospitals that we're recruiting, but we've had hospitals and facilities reach out from Georgia, the Panhandle, south of us. So, it's the word is out that JU grads are critical thinking, professional, caring nurses. And to me, those are some of the best qualities of a nurse.
Great. Thank you all so much for covering that. And for all the parents on the call, you all have made and your students have made a very sound decision. Speaking of recruiting, we received another question from an alum just about, recruiting during a pandemic and what our enrollment numbers look like. I know that this year JU did recruit its largest class to date. Dean Tillman or anybody else on the call, do you want to kind of jump in and talk about trends that you've seen in our recruiting efforts?
Sure. Yeah, I'll speak to that for a second, and then if anybody else wants to jump in, that'll be great. I'll just say that strategically we're making a bit of a shift at the university, and in the past, what we have done is recruited students to Jacksonville University, which is a great strategy. However, now we're recognizing how great our individual programs are, right? We've talked a lot about nursing. We've talked a lot about clinical mental health counseling. Those are amazing programs, and students want to enter those programs. So one of the things that we're doing right now is we're being more strategic about how we market. So now we're marketing individual programs more or less for the first time. So now we're gonna go out and let the public know about how great our nursing programs are, about how great clinical mental health counseling is. Another example I can tell you about is that we have an amazing School of Orthodontics that a lot of people might not be aware of. And I can give you some quantitative data that will tell you about these efforts. So each year what we do is we accept 15 residents into a master's degree program in orthodontics. And we also accept 8 fellows. So that means we're bringing in 23 new students a year. And right now we are going through the applications. the students that we're going to pick the best students for next year, we have 220 qualified applicants for those 23 spots, which to me is it's incredible. It indicates what a great quality program is, what a great quality program the orthodontics program is. Students, they want to come here, and we're going to reap benefits of that. We're going to take the top 10% of those applicants and accept them in next summer, and we are going to continue to be very successful.
Wonderful. And I know I've read some really impressive employment statistics too out of the college. Sort of on the other end of recruiting, can you talk a little bit about the job market, the demand in the industry, and how our graduates are doing? Yeah.
Yep, that's great. One of the things that we pride ourselves on is preparing our students, our graduates, to be workforce ready, and they are. We've talked about their licensure exam pass rates, and that goes across the board. Our students do an exceptional job, and I think that's also a reflection on the faculty and the quality of education that they receive. And that's really important, because when we look at the national statistics relative to healthcare, the healthcare industry, over the next 10 years, the growth rate is predicted to be 15%, which is far greater than the average of other industries. And what this translates into for us practically is 2.4 million new jobs over the next 10 years in the healthcare area, which is truly incredible. It's astounding. We picked correctly. So we're in a great area. And one of the other things that I think is also pretty amazing is that the median salary for these people who are graduating in the healthcare industry is nearly $70,000 a year. So our students are getting a great education. They leave here job ready, and they're being hired into excellent jobs. And one thing I'll add too is that about three quarters of our graduates actually stay in the region. So they stay close to home, stay close to JU.
Wonderful. Dr. Bourne, did you want to add anything? Okay, you're on mute. Sorry about that.
No, I was just saying that it's absolutely amazing. It's wonderful to think that. So yeah, thank you for sharing that, Dr. Tillman.
It is.
No problem. And I feel exceptionally lucky, because somehow I started off as an engineer, and now I'm lucky enough to be in healthcare sciences.
Yeah. And for those parents out there, for the undergrad, we have 100% job placement rate, so they can come off your payroll and start paying their bills.
That's what we like to hear during Family Week.
Oh yeah.
I thought that might make them feel better.
Yes, definitely. We talked a lot about our partnerships with other, hospital systems and things like that in the area. Can you talk a little bit about what we have going on with Availity, if we have any alums on the call?
Yep, sure thing. I'll speak briefly to this, and I think maybe Dr. Bourne will have something to add into. So we have a tremendous partnership going with Availity right now, and it's designed specifically to address a huge need in Florida. So it's actually a little bit embarrassing that of all the states, Florida ranks last in the nation in regards to access to primary health care. And it's mind-blowing to me. And this means that we have about 6 million residents, 6 million Floridians who simply don't have access to primary care physicians. So, this partnership with Availity is designed to directly address this need and this shortage. So in accordance with a new state law, House Bill number 607, we've partnered with Availity to provide a new mechanism for nurse practitioners to become primary healthcare providers. And what that mechanism is it's a set of scholarships. So Availity has provided us with $100,000 to provide scholarships for nurse practitioners to take the additional courses that they need from the Keigwin School of Nursing, such that they can become independent primary healthcare providers in the state of Florida. So this is just an amazing opportunity, and it displays, or it signifies this incredible partnership that we have that is going to ultimately provide timely, effective, and efficient healthcare for the citizens of Florida. Elaine, do you have anything to add to this?
Oh, absolutely. This is huge. This is something that we have been working for years. It took forever for us to be able to prescribe the needed medications that are controlled substances and requiring a DEA. And we finally were able to get that a few years ago. But now the ability to practice as independent providers, meaning that, as I was talking about a little bit earlier with having a collaborative physician here for our student health center, we have nurse practitioners. We have over 100 years of experience, many years of seeing many, many, many patients, but we've always had to, by Florida law, have a collaborative physician. There are some states where nurse practitioners have practiced independently for years. They were not required to have a physician to sign off on orders and so forth. And here in the state of Florida, while we are not required at this point for physicians to sign orders and so forth, we, by the state of Florida, Florida law must have a collaborative relationship with a physician. And so for here, us at the Student Health Center, we have a collaborative physician that if we need something, we can call on that collaborative physician. But honestly, here in primary care, there are so many things that we can manage without the need of a collaborative physician, which we are very thankful for. And this law actually requires those, or it actually allows nurse practitioners who've been in practice for, I believe it's 3 years that you've been in practice, that you have 3,000 hours that you've been supervised by a collaborative physician, and that you have within the last 5 years. This is where the hiccup comes in for us who've been in practice for a long time, is that within the last 5 years, you must have taken a 3-hour pharmacology course and a 3-hour diagnostic reasoning course. Well, I haven't been to school in a little while. And so that's where it's a problem for us. And so we are very fortunate to have this relationship and this scholarship, which will allow us to go back to school for those few hours and take these classes that we need. And JU is going to be offering this. I believe one of my colleagues that actually works here in the Student Health Center now has actually already taken one of the classes. It's a 4-week class. It's clinically based, looking at case studies, and it's actually a class that you will be able to use and benefit from it in clinical practice. And so this is a great opportunity for us. But once we have submitted our application to the Florida Board of Nursing, we've completed these courses, we have shown that we have been in practice for a certain number of hours, completed these courses, we will be able to submit that application to the Board of Nursing, and then they will review it and allow us to, if they approve, our application to practice independently, meaning we do not have to have a collaborative physician. And that will open up opportunity within our state for individuals, senior adults, even younger populations, to have healthcare providers, primary care providers that can manage their care. So this is huge for our state, and very wonderful opportunity for us here at JU, and as well as those throughout the state and the local area that are going to apply for this scholarship to be able to complete this.
Wonderful. Thank you so much, Dean Tillman and Dr. Warren, for touching on that. We're getting close to our time here. One final question to close us out. Y'all have to get out your crystal balls here. What types of predictions can you make for the group just about these long-term impacts that could come to the healthcare industry after the pandemic? It's a tough one. Dr. Tillman, I'll let you go first. Let you tackle it first.
Great, I'm lucky then. I'm just gonna comment on the educational side, and what I see is that we are going to be better on the other side. I think what we've done is we've we've picked up a lot of new skills. And we talked a lot about pivoting quickly and being nimble. And what we've been able to do is deliver our educational materials in alternative ways. And in a lot of ways, I think we've become more efficient. So, yep, it's been really hard. It's been really challenging. But I think we have learned so much from this experience that we're actually going to be able to deliver a better educational product on the other side. And maybe that's going to be the same in the clinics too.
I can speak to it from a healthcare perspective. I mean, this has completely changed, my plan for the development of our student health center. Never did I think about, wow, we're getting ready for a pandemic. This is what we need to do to prepare. I mean, it was a total pivot there really at the last minute of how are we going to be able to provide our services. And one of the things that we have done is as we have implemented telehealth medicine. And that's been huge for us. I mean, a lot of our appointments are initial telehealth visits, and we are evaluating students who have fevers, who have respiratory symptoms that we really want to avoid bringing them into the student health center, but we know that they need to be evaluated. And, telehealth was really just starting to take off now. And because of this pandemic, it has really pushed telehealth services. Would you agree, Dr. Summers? It has really taken off.
Yeah, absolutely. Whereas our profession had been slow to deal with telehealth and, dealing with ethics and all this, the pandemic just totally pushed us right there to say, we've got to make decisions. This is how it's going to be done. KCREP has been flexible, our accrediting body. It's been amazing to see. And Dr. Bourne, I love the way in which you framed it. That's what we've been doing in mental health, just helping students to positively reframe this thing so that they can positively reframe it for clients, and clients can do that for their families and communities. I always say, you know what, we were living in a sick way before the pandemic and the virus infected us. So yeah, appreciative. Unfortunately, it happened, but just reframing and pivoting from it in a whole lot of ways. We needed. No, we didn't need it. I hate to say it that way. I know what I'm saying, but for the sake of time, we've learned from it. We've gotten better. And like you said, we've learned new skills, and we deliver a better product. And so when the next catastrophe happens, man, we'll be prepared, and we can pivot just as fast, as quickly as we did with the pandemic. So lots of positives in this challenge.
No more catastrophes.
Yes, I echo what everyone has said. I feel that with every difficulty, there's opportunities. So this has just shown the world the value of nurses. 2020 is the year of the nurse, ironically enough. And we're positioned well to grow and be innovative and continue to serve our community.
Well said. Well, thank you all so much. I want to thank our speakers again for joining us, and of course, all of our alums, our parents, and our friends. For coming to this panel. It's just such an exciting time for the college. We're really thrilled that you could be here to hear more about all of our progress. We'd hope to see you back tomorrow as we close out Homecoming and Family Week. Tomorrow at 7:30, we're hosting a Dolphin Nurse alumni event on Zoom for anyone who's interested. And we are also wrapping up the week here on campus with a fireworks show live on Facebook at 9. Thank you all again for joining us. I hope you stay safe and healthy, and we will see you again soon. Thanks so much.
Thank you.
Thank you.
Bye.